We'll do this. But before we get started with water insecurity in Oregon, I just thought I'd share a little bit of information about myself. I was a student at Portland State University a long time ago, and I understand it's important for you all to know that there's life beyond the university. My grandmother is a PSU sociology graduate. My dad got a criminal justice degree here at Portland State. I graduated with a chemistry degree in '94, and my son Waylon graduated with a math degree just last year. So we're a true Portlander, and if you have any questions later on about professions in environmental sciences, environmental health, public health, I'm happy to answer them for you. After my time here at Portland State University, I worked at the DEQ for about 13 years, and I did water analysis, water data collection, Oregon Water Quality Index, and some information services projects. And I did that for about 13 years, and I've been working in public health and environmental health for the last almost 13 years as well. And besides with water work, I also manage the beach monitoring program, and that's where we look for fecal bacteria in the surf, and we let you know when there's hazardous conditions there. You don't want to go in the poopy water. Also harmful algae blooms, and we let you know when there's cyanotoxins out there in the lakes and rivers. I also manage a domestic well safety program, and that's all about talking with people about the importance of testing their wells and understanding the results and doing something with that information. That's all related to water insecurity. I do some bigger environmental health surveillance work, and that just means bringing together many different types of data, environmental hazards, demographics, built environment, community design, and health outcomes, and making that queryable and available for you all if you're interested in doing some research and looking at information about the environment and health. I also manage an occupational public health program where we're doing similar stuff with occupational public health indicators. I do work on adult blood lead, and I think last but not least would be the radon program. And this is National Radon Awareness Month, and it's really important, just like with private wells, with radon, you don't know what the levels are of radon in your home unless you test your home. And that's a really easy thing to do. If you have any questions about that, let me know. I've been talking on the radio and the newspaper pretty much all day and a lot of this month. So all I've been thinking about is radon lately. And I'm really happy to talk to you right now about water insecurity. But it's a little bit of a head switch for me. So please forgive me. I'm going to have to refer to some of my notes here to keep me on track. Despite the common belief that Oregon has abundant water resources, population and climate-driven pressures on water resources and water insecurity are a real concern for all people in Oregon. There we go. So water security, as you know, encompasses the elements that together ensure the water quality, quantity, and access are adequate to protect public health. An alternative definition of water security refers to a water system's ability to prevent and recover from physical security threats such as water contamination from chemical, biological, and radiological agents. Due to these varied definitions, and to emphasize the relationship to public health, we use water insecurity as our reference term. So we define water insecurity as inadequate and/or inequitable access to clean, safe, and affordable water for drinking, food preparation, sanitation, and hygiene. So these three key factors affect water insecurity and water security. climate changes that are increasing the frequency and severity of droughts, floods, wildfires, and other natural disasters, which strain our aging infrastructure and amplify water security threats to vulnerable communities. Social factors that affect access to clean and safe water, such as socioeconomic conditions, population distribution, and community engagement, among others. The physical determinants of water security, such as community design, housing, geographic location, can present barriers to access among the homeless populations, households connected to private wells, springs, or surface supplies, households with failing plumbing, and communities connected to small water systems. Now, preventable health outcomes of water insecurity include waterborne illnesses, exposure to contaminants, dehydration, malnutrition, and indirect outcomes such as emotional distress, depression, and anxiety. And I know that you've learned about these just recently. So there are an estimated 884 million people worldwide who lack access to safe drinking water. The Millennium Development Goal Report of 2015 estimated that 663 million people worldwide use unimproved drinking water sources, including unprotected wells, springs, and surface water, while about 2.5 billion use unimproved sanitation. Now, although there have been significant increases in improved access to drinking water and sanitation since 1990, people of poor and marginalized groups and those living in rural areas still have inequitable access to piped water. In 2010, the UN General Assembly and the Human Rights Council recognized the human right to water and sanitation as part of international law. Under these rights, all people should have physical and affordable access to sufficient, safe, and acceptable water and sanitation for personal and domestic use. These rights, however, do not entitle people to free water, unlimited use, and/or household connection. Therefore, policy development is critical to supply affordable water and sanitation services, sufficient water for personal and domestic uses, and water and sanitation facility access within or in the immediate vicinity of the household. So we'll talk a little bit about exposure hazards with drinking water. In the United States, water security is critical for the protection of public health. Drinking water contamination disrupts water access, leading to poor health outcomes from exposure and a sense of concern among communities at risk. This figure shows the number of waterborne disease outbreaks associated with drinking water reported in the US during 1971 to 2014 by year and by cause of disease. There's a total of 928 outbreaks during this period. There have been significant increases, you can see in the black part of that bar chart, in bacterial outbreaks of Legionella in the last decade nationally. Now, aging and in some cases overbuilt water infrastructure contributes to the development of biofilms that harbor bacteria. This trend is complicated though, because while all water systems are aging, reporting of Legionella increased due in part to CDC's promotion of reporting. Fortunately in Oregon, we have experienced only one recent outbreak. Now, exposure to naturally occurring arsenic in drinking water is a significant risk to some Oregonians served by private wells. Long-term consumption of water with arsenic above the drinking water standard may increase the risk of health problems of the skin, circulatory system, nervous system, lungs, and bladder. These health problems include some forms of cancer. This heat map, based on Oregon Domestic Well Testing Act data, displays relative risk for exposure to arsenic in private wells. You can see some of the hot spots there, and just also be aware that those data just reflect where more private wells and people are. And it doesn't say anything about arsenic generally across the state. In a state as water-rich as Oregon, which communities might be vulnerable to water insecurity? Populations experiencing homelessness in Oregon are disproportionately affected by water insecurity, with many relying on public facilities to access water for sanitation and hygiene. Lack of access can have public health implications, such as the spread of communicable diseases, skin infections, and other bacterial and viral infections. Water insecurity also impacts tenants or low-income owners in residences with plumbing in poor condition, low-income populations reliant on markets for relatively safe bottled water, and populations situated in vulnerable floodplains. Water insecurity also impacts counties with multiple consecutive drought declarations, low-income communities with deteriorating drinking water infrastructure and limited resources to fund improvement, and coastal communities vulnerable to sea level rise or saltwater intrusion. So, the Oregon Health Authority, we conducted a systematic literature review to understand the existing evidence base for developing public health policies, programs, and surveillance strategies relating to water insecurity in Oregon. By understanding water quality and quantity needs and inequities in access to safe water in Oregon, we can develop community-specific and culturally relevant water security policy solutions to help communities build adaptive capacity, strengthen resiliency, and protect the health of all people in Oregon. So we'll start out with surveillance, and the first thing I want to point out is that the literature on water insecurity from a public health perspective is pretty sparse, and we came up with 11 peer-reviewed, well, they weren't all actually peer-reviewed, some of these are actually great literature, so there's not a lot out there. This is a developing field. But looking at surveillance, Jepson measured water access, water quality acceptability, and water affect via surveys to assess how water insecurity is experienced at the household level. Switzer and Teodoro matched Safe Drinking Water Act compliance records with demographic and economic data for U.S. local government water utilities serving populations greater than 1,000. They found that by treating socioeconomic status, SES, as an interactive term, one can show that the interaction between race, ethnicity, and drinking water violations declines as SES increases. Gibson used property tax data in Wake County, North Carolina, to quantify the percent of residences with community water service in each census block, and found that increases in the African American population proportion within a census block correlated with an increase in the odds of exclusion from municipal water service. So they were less likely to be served by a community water system. Still along the lines of surveillance, Pierce and Jimenez compared water service reliability of households on small water systems with households on larger systems, and found that households living in mobile home park units are nearly twice as likely as residents of standalone mobile homes, and nearly 3 times as likely as residents in all other housing units to experience water service interruption, more likely to have their water cut off for one reason or another. McConan and Hoekstra analyzed satellite imagery to map water scarcity, which can be measured as the ratio of water consumption over water availability. And finally, the California State Water Resources Control Board displays current compliance status and other details about public water systems. So moving on to indicators, where you get to communicate your surveillance data. Sullivan developed the Water Poverty Index, which integrates information about local water resources, access to water, capacity to manage water, uses of water, and ecological integrity. The index helps to determine risks and priorities of water conditions at the community level and provides a cogent, transparent way to communicate the complexities of local water issues and their impacts on local communities. Cork and Ford adapted the Water Poverty Index to available data and needs identified in colonias along the Texas-Mexico border, identifying specific needed improvements for the colonias studied and allowing for more focus of community resources. And the California Office of Environmental Health Hazard Assessment developed indicators of exposure to drinking water contaminants, compliance with drinking water standards, physical and institutional vulnerability of public water systems, and affordability to measure progress towards achieving the human right to water. Now, in the policy arena, the California Human Right to Water Assembly Bill 685, passed in 2012, legislatively recognized that every human being has the right to safe, clean, affordable, and accessible water adequate for human consumption, cooking, and sanitary purposes. The policy regulated by the California State Water Resources Control Board applies to all Californians, rural and urban, and requires that all relevant state agencies consider the policy when developing and implementing related policies and programs. Recognizing that as I mentioned, the literature was pretty sparse, we reached out to key informants actively involved in solving today's water insecurity issues in California, Washington, and Oregon. So this is what's happening now. One of the key activities we discussed was the California Human Right to Water Law, which followed mobilization of multiple communities and non-governmental organizations focused on water justice. These communities recognize inequities in access to safe drinking water. California is assessing water insecurity needs, setting goals, developing resources, improving water affordability, and tracking progress. Washington State is pursuing water insecurity interventions through community education events, drought risk assessment, water loss detection, and utility rate capping. So Washington's activities look at water insecurity outside of the regulatory context and aim to increase awareness of the value of water and importance of water conservation. Now, water insecurity is not a term that was widely used in California or Washington, but both states are developing interventions to meet the unique needs of their communities. Future collaboration with these neighboring state agencies will present opportunities to learn about, share, and develop effective water insecurity interventions. There are recent and ongoing efforts among Oregon natural resource agencies led by the Oregon Water Resources Department to develop an integrated water resources strategy, gain a better understanding of the quantity and quality of water in aquifers, prepare for droughts, engage local communities in place-based planning, and develop a 100-year vision for water in Oregon. And you've learned about that a few weeks ago as well. To capture groundwater level data and climatic and seasonal impacts on aquifers, Water Resources continues to develop observation wells throughout the state and in basin study sites. The Department of Environmental Quality also conducts groundwater studies focusing on water quality and areas vulnerable to contamination throughout Oregon. And in response to the 2015 drought, partner agencies of Oregon's integrated water resources strategy conducted a survey across the state asking participants about their drought response and what actions should be taken to be better prepared for future droughts. So on to the recommendations. We recommend, from the OHA perspective, 4 water insecurity priority areas for Oregon, which integrate the intervention results discussed in the previous slides. Agencies can begin by studying secondary data to identify, describe, and quantify inequities in access to water. Mapping Oregon water systems, as done in California, will help us understand water availability and water quality among populations served by these systems. Oregon Health Authority's Drinking Water Services is already working on maps of water system boundaries and displays of active water advisories. We can better understand water insecurity challenges faced by communities and households by using an approach similar to the Household Water Insecurity Experience Survey. This could take the form of a modified Casper study or an American Housing Survey to fill critical data gaps and provide more transparency to water insecurity in marginalized communities. And there's already some efforts to start some of that work. We can work with natural resource partners to get a more detailed picture of water scarcity variability and mobilize place-based water planning efforts in regions found to be experiencing water scarcity. Now, bring all these together, and these efforts can inform development of a state policy, such as the human right to water, that would encourage an interdisciplinary collaboration between public health agencies, water resources management, academia, and policymakers to establish accessible, safe, and affordable water as a priority in future policy decisions. Thanks a lot. Please feel free to reach out through your questions now.
Curtis, we have the question. As a low-income student, as a low-income citizen, how would a low-income citizen go about knowing if the water in their area is safe?
Well, there's a couple of ways. Most of us, I would say all of us right now, are served by a community water system, likely the City of Portland's water system or surrounding communities. And all community water systems are required to produce an annual consumer confidence report. And in those reports, they used to mail them out. Now, of course, you go online to Portland Water Bureau, for example, or your local municipality. And you can look that report up. It'll give you information about the analyses that they've run. They'll tell you about contaminants and levels and actions that they're taking to protect you. Now, if you're served by a smaller water system, there should be consumer confidence reports. If there aren't, that's something you can always reach out to the state to find out more about. Now, about 20% of Oregonians are served by private water. So I mean by like private wells or springs, or they are drawing their water from a lake or a stream or a pond or something like that. There's no consumer confidence reports for that. That's really up to the person that's, the homeowner that's served by that well or that pump to take action to test their water and provide some treatment. Now, that works well if you're a low income property owner, but what if you're a tenant and you're in that situation? Right now as a tenant, you're served by a City of Portland, for example. Consumer confidence report still applies to everybody, but if you're living as a tenant in a home with a private well or surface supply, that's really, it's a discussion that you need to have with your landlord at that point, the homeowner, to do that testing and make that information available. And I realize that being a tenant puts you in a sort of power imbalance there, and it might be difficult to have those conversations and get that information. And there are organizations out there that help with tenant landlord rights and help you navigate that process.
Thank you. There's quite a few questions that kind of are around this question that I like how it's worded. What do you think are the most urgent issues for Oregon regarding water security?
Well, one of the things that's really apparent when we look around us is the social inequities, the wealth inequities that are abundantly apparent all around us. And, I think about the people who don't have a home, that don't have regular access to water, to drinking water, and that are having to think day by day about, where they, plan their day out to get water. To think about the water they need for sanitation and hygiene. I don't know if you're aware of the hepatitis outbreak in Southern California that was centered around the large homeless populations where they didn't have sufficient water around to keep themselves clean, and that allowed for conditions for communicable disease to spread like crazy. So, that's of concern. We know that in rural parts of Oregon, there's more and more water is being taken from aquifers where we don't really have a great understanding of the water resource, the water availability in those aquifers. So people are finding their wells running dry more earlier in the season and for longer, and for many rural Oregonians, that's a huge concern. Another part of, I think, of the biggest concern in water insecurity are communities that were able to make infrastructure investments decades ago to build reservoirs to store surface water, or to store water and transmit that water. And over time, those reservoirs can start to silt in. The transmission of the pipelines start to erode. The ability of communities to fund improvements to those facilities. We're seeing less of that. The communities are getting poorer, they're getting smaller, they're getting older. They're less willing to raise taxes on themselves to improve their water systems. So that's a real concern in many communities. Those are some examples, but I think we're at the point now where there are many groups here at Portland State and University of Oregon and other places that are trying to gather those stories and to really put things into perspective for all of us so we can get a good grip around the whole scope of water insecurity.
You mentioned briefly the mental health issues, and so there's a question: how does water insecurity affect anxiety and depression, and what is the supporting evidence?
I touched on that a little bit. You can see me another time for following up with some of the literature, but when I was talking a little bit about the homeless populations, this also goes in those rural situations where you're served by a well. And your well's going dry earlier, or you're in a drought situation and you don't have water at home. You might be able to afford, tanks of water coming in, afford a lot of bottled water, but on the other hand, you might not. So that's going to take up some of your mental capacity, thinking every day about water. Where am I going to get water to cook? To drink for myself and my family. How am I going to get water to bathe and to wash up? If I depended on that water to grow my garden, to feed myself and my family throughout the year, now what am I going to do? So you've got these levels of anxiety building up, leading to depression, and in some cases, more significant mental health issues.
So this is a question near and dear to my heart because it's about data. Have you encountered challenges in collecting data relating to Oregon's water security? What have been the main challenges?
I guess I can say not yet, but only because we're just at the point now of having completed this literature review, and we're trying to get this published so we can use this to gain those resources to collect that data. Now, some of the data are pretty easy to come by. Some of these studies use administrative data like census data and other locally collected data that you can bring together and say something about who's being served by public water supplies versus private water supplies. There's some of the, I mentioned a study that was about remote sensing, so satellite data, and those sorts of things are relatively easily available and would take maybe a minor effort to pull together a model of water scarcity variability. But I'm not a modeler, so it's easy for me to say that. If anyone's a modeler in the crowd, they probably know it is a significant effort. But to get out into communities and do those surveys to understand what are people experiencing directly about water insecurity, that can take a significant effort to go out in the community and try and get 150, 200, 250 survey results from communities that in rural Oregon might be resistant to sharing that information. So, then the barriers besides the resources might include trust and who are trusted members in the community that can go out and actually elicit that sort of information. So it's still really early yet. To be honest, we haven't collected a lot of that data that are needed. So stay tuned, and maybe you'll be in a position to help out.
A lot of the questions are also, I have noted that you learned what's going on in California and Washington, and so kind of on, piggybacking on that question, we haven't quite put together the data sets in Oregon. What are you learning from California and Washington?
Well, I would say they're not super comparable. I'll start with Washington, where they haven't really collected a lot of data either, but I'll start with Oregon, and I work on the same floor as the Drinking Water Services Program, and they are, the resources are limited to working within the regulatory context and administering the Safe Drinking Water Act. The state of Washington, they have other sources of revenue in the state than we do. And so they've been able to take advantage of that and work on non-regulatory approaches like education, rate capping, conservation efforts. Now, the state of California, I think it's different, way different, largely because they've had a huge agriculture sector in large farm worker communities that have historically been marginalized in how they've been allocated safe drinking water. They've been, in many cases, excluded from safe drinking water from community water systems. And so over the years, they've become more knowledgeable and vocal, willing and able to speak out about water justice issues. And so I think that effort has got to go back, 15 years or something like that, to develop the water justice initiatives, the non-governmental organizations, to bring these concerns through the legislature in California and get to a point where they passed the law in 2012. Now, that's, now it's 8 years ago, and it's only just last year that they published their framework that a lot of that information you saw about indicators and surveillance. And so they can measure, they can evaluate their progress of applying these policies to water justice. So California is way, way ahead of us, but they provide a good model of how to work with community groups, NGOs, to get these policies into fruition, and then agencies to work together to develop the tools and platforms to evaluate those policies.
How do you define water justice, and what should be the highest priority for water justice in Oregon?
I won't comment on what I think the highest priority is for water justice. That's really not for me to say. I'm not in the right position, I think, to state what I think is the most important thing for water justice. I think it's more important for me to listen from those communities that are facing water insecurity and water injustice, to learn from them what the most important problems are. That's really not for me to say. So that's why I'm really hopeful that more of these stories will come out, so we can understand more than from my perspective. We've done a systematic literature review. We can gather some data. We can help to define some of the communities, but then really the rest of that's coming from the stories of the communities, so we can understand what the needs are and how we can deal with it.
As far as the OHA, is the OHA targeting particular communities and their water security, and which communities?
Yeah, I wish I could answer that question. We're at the stage where we have some recommendations of ways that we can better define those communities and have a better idea of where they are, who they are, and then who to work with. But yeah, at this point in time, I can't fully answer that.
Quite a few students asked about the human right to water bill, and does Oregon have something similar? Will that be included in the 100-year plan?
I don't know. I mean, that's our recommendation. There's nothing like that in Oregon now. I'll start with that. And that is our recommendation, that we work towards a policy like the human right to water. And I think that the UN set out a good goal, and that California has followed up, and I think it's a reasonable model, it's a reasonable approach that I'd like to see happen at some point in time. I've been involved in water, even before I was at Portland State University. I was involved in water, so it's a passion of mine, and I'd like to see some improvement on that.
Some of the questions are about what are the challenges in Oregon. So you've been here, you grew up in Oregon, you've been working in Oregon and water also a long time. So why don't we have something like this yet? What are some of the challenges and barriers to something like this in Oregon?
Well, you probably heard me refer to a couple times where I say, despite the common belief that Oregon has abundant water resources. It's like the story of one of the stories of Oregon is, hey, we're water rich. Water's not a problem. What are you talking about? And we know, is because of changing climate, because of changes in populations and demographics, because of our aging infrastructure, and it's harder and harder for communities to maintain, let alone improve that infrastructure. We're facing these issues. So first of all, it's like breaking through that barrier of the old status quo, that there's plenty of water in Oregon. And there's plenty of parts of Oregon where that hasn't been the case. And if you go and talk to folks out in southern, far eastern Oregon, central Oregon, they'll say that, yeah, we've had problems with water off and on. To them, since we just deal with it, we don't think that people in the valley really care about it anyways, because they've got a lot of water over there. So, I think it's the barrier is about, I guess, listening and understanding the pressures and stresses and the water insecurity experiences that people have. I think that's the first thing that I'd like to see. I'm not sure if that completely answered the question. Good enough?
Sure. I think that just a personal note, there are many barriers. That would be an entire presentation in and of itself.
Sure. I mean, resource barriers. I think we're starting to see some of that now with, the 100-year water vision isn't fully baked yet, but there's already, I think there's introductions in this short session called policy option packages to get resources to agencies to do better at integrating data and get resources out to the Water Resources Department. I think that water vision will help drive the ask of the state legislature for more resources to address water concerns. But I think there's been an understanding that there are water quantity issues in Oregon for a long time, but there hasn't been a lot of talk about the human connection to water. So a lot of the talk about water is wells going dry, different industrial agricultural needs for water, and water is kind of abstract, and it's hard for people to connect to that discussion until they understand the health implications of water insecurity. And so I see that, again, that's part of that storytelling thing. I think it's still going to be a little while before people can make that connection. Water insecurity, the public health perspective of water security is relatively new into this discussion, and I've still been trying to work to get these recommendations included in the dialogue about water in the water vision. And I'm hopeful that will get in there. Water resources and the natural resources agencies are really happy to have public health at the table. And I'm happy with that as long as they actually listen to public health and incorporate some of our recommendations and help move things forward.
Yeah, well, I think also a big piece of this is especially when we're talking about water justice and environmental justice, the people who are impacted the most don't have the power to be involved in the short legislative session, to know who made a lost garden is, to know where the website is, to put public, to give public comment.
That's true. And then there's a good 45-minute documentary about the story of the human right to water in California and the time it took for individuals to mobilize within communities and those communities to engage with environmental justice organizations and those communities to work together and inform local legislators and then to go back and forth in the legislative process, and that takes time. So you can't really think about short-term and long-term, short session and long session. You have to think of multiple sessions, multiple long sessions to get big concepts through. And I'm not sure that we really fully understand the need yet, and it can tell a compelling story such that that a human right to water could come to be. And to me, just because I was trained in science, I'm still unsure that those stories are out there. I'm waiting for those stories to fully emerge so that we have something to work with.
Well, that's interesting too, because environmental justice, when we talk about these EJ communities, these communities that are being disproportionately impacted by water insecurity. First of all, water might not be their primary problem, especially if you're talking about the public health aspect and the mental health aspect. But then also as a community, water might not be the most prominent problem to deal with. And then to come together around the environment as an environmental justice issue and then bring that story forth to agencies is a really big ask for people.
Yes. I totally agree. Water is so fundamental to our existence. We can, how long can we go without water? You can't go, air, of course we need air, right? Good quality air is a little bit secondary to just oxygen. Water, the water's not that great, but it'll do. I've got bigger things on my mind, other things I've got to be concerned about. I get that. It's more acute though in those situations where people they can't turn on a tap regardless of what that water looks or tastes like. If they're trying to figure out just day by day where am I going to get water, let alone, if I'm, going to cook food, how am I going to cook it without water? Those sorts of issues in some communities are going to emerge as being more serious situations. You're right. It might not rank up with their own skill in a lot of people, but I think there should be enough stories out there.
Well, that gives us a lot to think about in terms of what kind of research questions and research designs that we can think about to learn more about water justice and water insecurity in Oregon. So thank you very much. I hope everyone can come and join us at Rogue tonight. Thanks, Curtis.
Thank you, everyone.